Good afternoon, everyone. I'm Lydia Chwastiak. I am a psychiatrist and a professor of psychiatry at the University of Washington, and I am one of the co-directors of the Northwest Mental Health Technology Transfer Center. And on behalf of the Northwest MHTTC and also the Behavioral Health Institute's Training Workforce and Policy Innovation Center, I'd like to welcome everyone to today's webinar. This is the initial session in a series of webinars that we're jointly sponsoring, and the goal is really to support community-based behavioral health providers in Washington State on their implementation of telehealth services. So we appreciate that this is a very urgent issue in the context of the COVID public health emergency, and we know you have a lot of questions, so we're grateful that so many of you could join today, and we're very excited about our panel who has extensive experience and expertise with both the clinical and administrative issues, and also that this series will provide an opportunity to share information and resources among the community. So to that end, we've structured these sessions so that most of the time will be dedicated to Q&A and discussion. So before we begin with the webinar, I just want to address a few quick housekeeping items. If you have technical issues during the webinar, please submit those questions in the chat box at the bottom, the chat, so that one of our staff can work with you around technical issues. But if you have questions, content questions for our experts, we would like you to put them into the Q&A box so that the team, the panel, will be working to compile them and review them at the end of the presentation. And just a reminder that we're not offering certificates or CEUs for this webinar, so we'll follow up with you once the recording and any accompanying materials are ready and are posted to our website. A couple of words about the MHTTC. The network is a national network that's supported by SAMHSA, and the goal is to support the behavioral health workforce to implement evidence-based practices for mental health disorders. The Northwest MHTTC, we serve Region 10. We're based at the University of Washington in the Department of Psychiatry and Behavioral Sciences, and we provide training and technical assistance in evidence-based practices to Region 10, which is Alaska, Idaho, Oregon, and Washington. Broadly, our goals, I hope most of you are familiar with our MHTTC. Our goals are really to heighten awareness and knowledge and skills of the workforce to address the needs of people with serious mental illness, and also to accelerate the adoption and implementation of mental health related evidence-based practices across Region 10. A couple of reminders, just it's our intention to always be mindful of using language that promotes recovery and culturally appropriate terminology. So we encourage all clinicians to use and champion person-first language, which emphasizes the individual, not the condition or disability. Person-first language is a way to demonstrate respect for a person's dignity and worth, and it's consistent with recovery-oriented practices and promotes treatment environments that foster respect, human dignity, and hope. Few logistical things to review. Again, we have the chat box, which is where you can share technical issues and non-content questions, as these will be visible to our team. The second point is just that your questions are extremely valuable to us, so we would want you to put those into the Q&A box. So the chat box is not for content questions, but the content questions should go in the Q&A box. A couple of options for, we really want to hear your feedback both in this session, but also as this will be a series of 8 webinars, we really want to take your questions and comments and put them and have them inform subsequent sessions. So please put your questions into the Q&A window. You can raise your hand. There's a feature to raise your hand during the webinar, and our panel will try to get to you to answer questions, but please also put them in the Q&A box so we will have them and we can get back to them after the webinar. We'll also be putting the slides on our website, so those will be available as well. So your feedback is really critical to us, and so we really want, at the end of the session, we'll be asking you to complete a very brief survey just to let us know who you are. It's helpful for us to know what kinds of folks are attending the webinar, what your role is, whether you're a clinical provider or more in the administrative realm or some other some other roles. So really want to help us inform, kind of shape the content and the structure of these subsequent sessions. So we will be asking you to complete a brief survey at the end. I think the next slide, we just want to, I'm delighted to introduce our presenters today and our partners at the BHI. First, Cara Towell is the Associate Director for Telepsychiatry at the University of Washington. She's a nurse by training with over 20 years of experience in developing and managing telehealth programs in rural regions and regionally and internationally. And she has a recent focus on using telehealth technology and innovative care models to training improve access and quality for mental health care services. She is a founding board member of the Northwest Regional Telehealth Resource Center and a board member of the Washington State Telehealth Collaborative. So we're really delighted to have Cara join us today. She's joined by two of my colleagues in the Department of Psychiatry, Dr. Brad Felker, who's a psychiatrist at the VA. He's dually trained in psychiatry and internal medicine, and his career has focused on integrated care. He's an international expert in digital health and trains our fellows, our residents and fellows in telepsychiatry. So we're delighted to have him join. And Dr. Mark Avery is another member of our panel. He is a psychiatrist and a principal consultant for Health Management Associates. He's a clinical professor of psychiatry in our department, and he has spent much of his clinical and academic career working on the development of integrated primary care and mental health care for high needs and safety net patients. And Randy Gray is also joining us on our panel. He's a senior computer specialist at UW Telehealth Services, and he's an expert on all things technical related to video teleconferencing, has been a key figure in deploying telehealth technologies across UW Medicine. So also really delighted to have Randy join us. So I will turn this over to Melody McKee, one of our partners in sponsoring this series. She's the program director for the Behavioral Health Institute's Training, Workforce, and Policy Innovation Center at the BHI, which is based at Harborview. Melody is has a master's degree in mental health counseling and has worked in behavioral health for the last 16 years. And she's new to the BHI, and we're really delighted that she's joining us and our partner in this series. So I'll turn things over to Melody.
Thanks, Lydia. Good afternoon, everybody. As Lydia stated, I'm the program director for the Behavioral Health Institute's Workforce Training and Policy Innovation Center, where we have the vision of standing up a statewide infrastructure around quality training across Washington State. And one of our early partnerships is this one today, where we're thrilled to be partnering with the Northwest Mental Health Technology Transfer Center to present this training. So now that we have introduced ourselves to all of you, we would like to hear a little bit about who you are. We're going to put a poll up that's going to ask you where you're coming from in terms of participation today. So if everybody could just take a couple minutes to answer the poll.
Great. Well, this is Cara Towell, and thank you for completing that. That's really helpful for us to see who is attending. It looks like we've a pretty even between behavioral health clinicians, administrators, and other. So be interested to find out who other is when we get to the Q&A session. So thanks for sharing that. I'm going to go ahead and share my screen now. And whoops, well, there's my slide, and we're going to be talking about really basic level nuts and bolts as part of the kick for this series. So as this is the kickoff session for this series, we'd like to use it as an opportunity to review some of the basics, and that'll include a quick review of the definitions of telehealth and telemedicine too, a review of how to access the laptops and Zoom accounts being Healthcare Authority to support telehealth during this public health emergency, Because HCA has chosen this platform, we're going to review some tips and functionality, and then regulations as they pertain to the technology for telehealth. And we have two sessions for your feedback to identify needs for further training and assist. We think we have some pretty good ideas about additional topics to be covered, but we'd really like to hear from you to see where you feel like you need additional assistance or guidance. And based on that, we're going to build out the curriculum and invite some additional expert speakers. As Lydia's mentioned, this series will be offered twice a week for 4 weeks, and we hope that by the end of the 4 weeks, maybe sooner, you'll be able to start telehealth to your patients. After that, we hope to continue this series way for participants to find ongoing support and assistance, not just from those of us in Seattle at the UW and Harborview, but as part of a community of practice where all of you expert field can share your challenge and successes and tips and resources that have worked for you. So just a quick disclaimer, any information provided today in today's talk is not regarded as legal advice. I'm certainly not there. Talk is purely for informational purposes, and if you do have specific legal questions, we ask that you with legal counsel, and the presentation is based on information that was available as of mid-April. So let's talk about quickly definitions of telemedicine. There's not really a definition of telehealth or telemedicine. I feel like the Institute for Healthcare Research Quality has a nice definition for telehealth, which is the use of telecommunications technologies to deliver health-related services and information that support patient care, administrative activities, and health education. The American Telemedicine Association has a nice definition, I think, of telemedicine, which is the use of medical information exchanged from other via electronic communications to improve a patient's clinical health status. So I think really a umbrella term that includes educational and clinical services, more specifically to clinical services. It might be important to understand the definition in terms of what it's being paid for. So CMS defines telemedicine as a two-way real-time active communication between a patient and a physician or practitioner at a distant site through telecommunications equipment that includes at minimum audio and visual equipment. They do actually reimburse for what's called store and forward telemedicine when you, for example, send a dermatology image and it's not a synchronous interaction, but that's only paid for in Hawaii and Alaska. So during COVID, during this crisis, Medicare has pretty much stuck with this definition, but they do offer reimbursement for, do not consider to be telehealth services, but they would call rather technology-enabled services, including telephone, virtual check-ins with established patient visits, and remote patient monitoring. In Washington, we have defined telemedicine as when a healthcare practitioner uses HIPAA-compliant, interactive, real-time audio and video telecommunications, including web-based applications, or store and forward technology to deliver covered services that are within his or her scope of practice to a client at a site other than the site where the provider is located. If the service is provided through store and forward technology, there must be an associated office visit between the patient and the referring healthcare provider. Notably, that definition does not include telephone, fax, or email. However, Washington Medicaid has expanded to include coverage of other, quote, I'm reading, other forms of health, such as online exchange through a patient portal and telephone calls, FaceTime, or email, and to a limited extent, texting may also be used. Keep in mind, all of these variations are only valid during the COVID public health emergency, and so I guess we need to see what happens afterwards and which variations stick and which ones are rescinded. So I'm going to talk a little bit about the equipment and software that is being offered by the Healthcare Authority. So they have purchased a number of laptops and Zoom licenses, and the laptops are considered to be loaners, I understand, and they will be, who do qualify for this and get a laptop will be notified of the laptop and when it must be returned. There's some eligibility. This is the site where you can apply, but the eligibility is that you have to be medical provider, behavioral health provider, or recovery-based organization who do not have access to a laptop or the resources to obtain one for the purposes of offering their services through telehealth. So not everybody will be approved for this, but it seems that if you meet criteria, you're going to be approved. Headsets I'm going to talk about in just a second. And then Zoom, access to the Zoom account. Again, here's the application website. And Zoom is the HIPAA and 42 CFR compliant software platform that's being offered by HCA, and that's what we're using today. Eligibility includes that you serve a meaningful number of Medicaid clients, you don't already have this technology, you're in a smaller practice with less infrastructure, you serve children, pregnant or parenting women, are an opioid treatment program or a CMHC, or that you support or prescribe medication for those with significant mental health or substance use disorders. HCA has configured these licenses to protect against video conference intrusions and to protect patient privacy and confidentiality. So some of the things that are included is a virtual waiting room where only the provider can admit a patient in, and we're going to talk about that in a minute. Also that only the provider can share content via the video screen. We'll also address that in a little bit. And then recording the class of a session with a patient is also disabled. I've added, and we'll talk about that also, I've also added under equipment that you might look into purchasing that, again, to improve the privacy and confidentiality of medicine practice. So once you've applied to the HCA and been assigned a Zoom account, the HCA Zoom telehealth FAQ shown here will show you how to activate your Zoom account. Once you've activated it, you can access Zoom by going to the Zoom login page, which is zoom.us. Use the email address and the password that you use to register with HCA. When you sign in, always be sure that you are in your HCA Zoom account, not in a personal one that you might have gotten for connecting with Zoom family, because likely that one is not going to be HIPAA compliant. HCA is recommending that for telemedicine patient appointments, you use a recurring meeting link. So that means setting up a one-time link that all of your patients will be able to use. And HCA is also recommending that you use the personal meeting ID for that recurring meeting for telemedicine appointments. So I'm going to talk about that in greater detail in just a second. Let's see. And so we're going to talk about how to set up those meetings and how to use it for patient appointments. And we're also going to talk about using the waiting room function and about non-clinical uses for Zoom. So when you sign into Zoom and click on your profile, this is what you're going to see. And I apologize, it's a little bit blurry, but this is what you'll see. This is your profile page. And to schedule the recurring meeting for Zoom appointments, you use your Zoom personal ID, which is located where that arrow is pointing. And you'll see that it says personal meeting ID. It has the actual number, which I think is going to be a 9-digit number in most cases. And then there's also a link there. That's the link that you're going to use to copy and paste and send to your patients when you schedule an appointment with them. So in order to set up this recurring meeting, you want to, again, sign in, and then you can go to your profile page and copy and paste that link in there so that you have it handy. Oh, sorry, you can also add a photo of yourself if you would like to here in the page. Anyway, so then when you're scheduling the meeting, you click up here on schedule a meeting, and then it'll bring you to this page. In the topic field right here, I recommend that you enter a phrase that identifies the meeting, something like telemedicine visits and the name of your clinic, for example. You would check the box where it says recurring meeting, and then under recurrence, there's a pull-down menu here, and you would choose no fixed time. And that way you're setting up this meeting so it can be open and used 24/7, 365 days a year. Leave the schedule for as myself. You probably won't have other options, but if you do, use myself. And then down here, HCA wants you to use the personal meeting ID. So even though the other one isn't checked, we want you to use the personal meeting ID. So you click on that. Then, as you scroll down, as you're setting this up, there are a couple of other things that you just want to be aware of. You don't want to, you don't want to require a meeting password up there at the top. You want to have both host and participant video on. You want audio to have both checked. And then the meeting options, you want to enable join before host so that a patient can join the meeting even if you haven't opened your account yet, and they can be sitting there in the waiting room. And then you want to make sure that enable waiting room is checked. Now, I think that the AHA has set this up so that it is checked, but as you're setting this up, just sure that you accidentally get it, but just make sure that that's checked. This is really important because the Zoom function will allow you to control who comes into your Zoom meeting that's open 24/7. If you're holding your 9 o'clock patient appointment and your 10 patient signs in a few minutes early, then they're not going to jump right into the meeting with your 9 o'clock appointment. You will just see that 10 o'clock patient in the waiting room for you. And then you click on save. And then per the HCA guidance, once you have sent and you scheduled your appointment with your patient and sent them the Zoom link, and then they go in for their appointment and they click on the link and they enter into your waiting room, you should receive an email message when your patient has joined your Zoom meeting. Be aware that that could very well go into your junk mail, so check there too, assuming you have this on your schedule anyway, but check there, and if you see it's gone into your junk mail, you might want to check with your IT to see if you can make sure that that comes into your regular inbox. When you sign in, be sure to sign into your Zoom account before opening the Zoom appointment. If you just click on that link, because you've cut and pasted it and copied it somewhere, if you just click on that and you're not signed into your Zoom account, it does not recognize you as the host, and you won't be able to admit the patient from the waiting room or do the other functions. So always sign in, then click on the meeting link, and then you'll see, if you hover this bar at the bottom is not always showing, so you have to hover your cursor over there and you click on manage participants, and it will allow you to admit the patient who is in the waiting room. Note this green button down here is the share screen button. So if you want to share some documents and, on the computer with your patient, then that's where you do it. You click on that, it'll bring up your top, and then you double click on the document that you share. When you're done sharing, up at the top of the screen, you hover your cursor up there and you'll see a red button that says stop share. Let's see. If you would like to, you can also invite someone else into the meeting, such as another clinician or something like that. And you just click on that button and type in the email address. And at the end of the appointment, if you're finished seeing patients, you can click on end meeting. But if you have your next patient in the waiting room, you can remove the patient and then admit the next patient. I will show how that looks. So click on manage patients, you'll get a sidebar to show up, and right you can see which in this example was me, is in the waiting room. You just click on admit. You can also put the patient back into the waiting room. So you can see on this, once you've admitted the patient, and you can hover over the patient's name and then click on more, and you'll get this pull down menu. So down towards the bottom, you can see put in waiting room. So if you have to step away for some reason, you can put them in waiting room so their video is not visible to anybody else who might want to walk by. You can send a chat message. You can actually send a chat message to someone who's in the waiting room who you haven't admitted yet, just to say, give me 5 more minutes, I'll be right with you, or something like that, but they can't respond to you. You can manage the patient in a few other ways. As you can see there, there's a make co-host and make host choice. Please do not ever do that with a patient. If you give the patient if you make them a co-host or the host, that gives the patient control over the meeting. They can admit whoever's in the waiting room. They'll allow them to control future patient appointments. So never make the patient a co-host or a host. Also, never allow record the patient. So as I said earlier, the recording function to the cloud has been disabled. And when you are the host and the patient is in there, they could click on the record button, but it'll ask the host to allow you to record. So if that ever happens, or if you just pull it down, never click on allow record, because we don't want patients recording your sessions. And you should also record. You are disabled to recording to the cloud, but you could actually record to your personal device, but don't do that because that becomes part of the patient record and it opens up a Pandora's box in terms of HIPAA and secure storage of videos and things like that. So we really discourage you from doing that. There's also, as many of you probably have discovered, you can use Zoom for non-patient meetings too. So if you would like to use Zoom for non-patient meetings, such as connecting with another provider or holding an administrative meeting, first of all, the people that you invite to the meeting, they do not have to have a Zoom account of their own, nor do patients, by the way. And then you would just use the same process as you did when scheduling that recurring patient meeting, except when you go into their schedule a new meeting, you would obviously change the topic, maybe behavioral health team meeting, something like that. You can, if you're going to schedule a recurring meeting, you would click again on the recurring meeting box and either choose a no fixed time, or you could choose the specific recurring time. If it's a one-time only meeting, don't check the recurring meeting box and you'll be able to schedule a specific time and date. Again, schedule for yourself. And this time, you definitely want to choose generate automatically. So that will, instead of using your personal meeting ID, which you're using for all of your patient appointments, this will generate a different meeting ID to use for your administrative meeting, let's say. In doing so, you can decide all of those other settings if you want to have a password or enable before to join before host or use the waiting room and that kind of thing. It will only be for that meeting. It won't change it for your personal meeting ID. So the reason why we really want you for anything other than the patient appointments, use the generate automatically button, because if you use your personal meeting ID to schedule an administrative meeting, for example, you would run the risk of having a patient randomly trying to join the meeting. Or if you're fiddling around with enabling and disabling the waiting room and then you forget to enable it again, and then before you know it, you've got your 10 a.m. Patient jumping into your 9 a.m. patient appointment. So, so be wary of that. Keep in mind that although you can use your Zoom account to schedule more than one meeting at the same time, you can't actually hold more than one meeting at the same time on your Zoom account. So best practice is don't schedule Zoom meetings at the same time. Okay, and now I'm going to talk a little bit about HIPAA and security as it applies to technology. So the Office of Civil Rights, OCR, has a waiver in place during the COVID public health emergency, which is effective March 17th. It says that a covered healthcare provider who wants to use audio or video communication technology to provide telehealth during the COVID-19 public health emergency can use any non-public facing remote communication product that's available to communicate with patients. OCR is exercising its enforcement discretion and will not impose penalties for non-compliance with rules in connection with the good faith provision of telehealth using such public-facing audio or video communication products during the COVID-19 public emergency. This exercise of discretion applies to telehealth provided for any reason, regardless of whether the telehealth service is related to diagnosis and treatment of health conditions related to COVID-19. Basically, this is for people who are not using the Zoom licenses from the VA that are HIPAA compliant already. So normally HIPAA does not allow you to use things like FaceTime or Facebook Messenger, video chat, or Google Hangouts, or like that video, because they're not HIPAA compliant. But during this public health emergency, they are allowing you to use that as long as it's a non-public facing technology. Some examples of a public-facing technology might be Live, Twitch, or Talk. And this is all information that I don't understand because I'm not a millennial. So let's see. So again, HIPAA Zoom licenses, HCA Zoom licenses are HIPAA and 42 CFR compliant. Washington Medicaid, under these circumstances, Medicaid is covering a variety of technology modalities in lieu of in-person visits to support the evaluation, assessment, and treatment of clients. And these modalities include, again, the HIPAA compliant interactive, which has already been covered in normal law, in the forms of telehealth, such as online digital exchange through a patient portal, telephone calls, FaceTime, Skype, email. Texting can also be used, but the agency cautions as to the extent this should be used for doing assessments and providing treatments. And I left you the site where this information is coming from. So as a reminder, HIPAA has been waived in many instances duration of the COVID-19 public health emergency, but it's still important to protect patient personal health information to the extent possible. So HCA encourages providers the account issued by HCA telehealth solution. However, per HCA questions, clients must be informed if you're using a non-HIPAA compliant technology. And you can do so by using mail or electronic means to obtain a signature, a signed consent by the patient. But then if you can't do that because you need to schedule the appointment immediately, you don't have the electronic access or something, the next option is to verbally consent the patient to participate using these technologies. But the information provided and the verbal consent must be documented and dated. And then once in-person visits are resumed, the client must sign a consent form that communicates in writing that the client provided consent to a platform that could not protect their information, or it presumably could send in advance if you're in person. It's not going to take a while. In addition, we of course recommend that you take precautions so that the patient should feel confident that no one else is seeing or listening in to your appointment. So, make sure you're in a private setting, make sure that you have sound insulation and avoid background noises, avoid people walking behind you because it doesn't feel very secure, avoid disruptions, maybe put a sign in that you're in session so you're not interrupted. Again, make sure there's not a lot of background activities going. And likewise, the patient should also take this into account, and they should find a private setting that is not going to be disturbed during the session with you. Remember that in a patient visit held over Zoom or any other video conferencing technique, you need to document if there's anyone else who is participating either on your end or at the patient site, or anyone who joins by video technology. So that's pretty much the end of what I'm going to share today. We did want to start out and see if we could take another poll, and if our technical team could put that up. And this is just to sort of see where you folks are in implementing telehealth services. Okay, very good. So it looks like we got 55% who are just getting started now, 35% who have been doing it for 1 to 2 months, and 2% who have been 2 to 6, and about 8% doing it for 6 months. So it looks like we have a lot of newbies joining the call. So that's great. Let's see. We'd like to entertain any questions that you have about the presentation, and also talk about what barriers or challenges you have faced in getting started with telehealth. Gosh, I think my computer has, oh, there we go. We want to know what's working well or not working well in seeing patients from home. And then we want to know how we can best support you what training or tools or supports would be most helpful for you to get started. So let's see. Looks like we have a few questions. Let's see. I'll just take the first question, which is text messages with providers. What codes can be used in communication with providers and members? So I'm going to actually defer billing questions today because we are pretty sure that next Wednesday at this time, we're going to actually have a whole session on billing and reimbursement. So, I mean, it looks like the first questions have to do with billing. So I think if we can defer those until next week, that would be great. What guidelines and requirements constitutes an application such as Zoom to be HIPAA 42 CFR compliant? I might toss this to Mark Avery to see if he would like to do that.
Sure. Yeah, thanks. It's a little bit of a difficult question. So again, the question is what constitutes a HIPAA compliant application for Zoom? So if I understand the question correctly, you're asking of whatever platform you select, how do you know if it's HIPAA compliant? So there's actually two answers to the question. There's the before COVID-19 answer, and there's the after COVID-19 answer. So the before COVID-19 answer is, it actually used to take quite a bit of work to scope that out. It took a fair amount of due diligence to do some research into the platform you're looking at. Zoom has a HIPAA compliant variation of their platform. That's the one that the state purchased. And there are other tools out there that report themselves as being HIPAA compliant. The second thing is to look into that a little bit more and say, what is it about them that makes them HIPAA compliant? You would want to be looking for, are they using the sufficient amount of encryption of their signal? Are they using the appropriate type of transmission, such as end-to-end transmission? And do they have certain features disabled that would, which would be non-HIPAA compliant, such as the ability to record or face or public-facing features? That's before COVID happened, and those are fairly sophisticated questions, and so typically you needed somebody with an IT background to help sort that out. And then the final thing you needed was a BAA with that company. So you would actually get a BAA, that's a HIPAA term, from Zoom or from whatever platform you went for. However, with the changes up at CMS and at the federal level with regard to COVID-19, they've relaxed that rules and basically said they're not going to prosecute anybody for their choice of a platform during the time of this public health emergency when you, in good faith, chose a platform that you thought was secure and appropriate for telehealth. So there's a window of time here for us to, if there's a little bit of a silver lining of this COVID epidemic, is it allows us to kind of get our feet wet with doing telehealth, because it used to take quite a time to get this stuff set up because of having to cover all those other bases. As long as you choose a platform that you feel is in good faith, that you think it's a private and secure method of communication. And then if there's anything about that platform that you feel is not private or secure, you also have Cara mentioned the step of doing, getting the patient consent. You want to be sure to consent that with your patient before you start that session to make sure that everything's on the up and up with that.
And
thanks, Mark.
Consent in the medical record, right?
And that's right. Thanks, Cara.
Yeah.
Hi, Cara. We do have a hand up, so I'm going to
Okay.
go to the raised hand. We have Donna Larson Limerick. I'm going to unmute you, Donna, so you can ask your question.
So one of my challenges right now with the COVID is that I'm at home. I can't see clients face to face. I work with a lot of homeless clients. I have one particular one who is in jail, and so we can't visit jail. So I have, in the last couple of visits, been using their technology, which I know is not great in terms of HIPAA, but is it something that Medicaid will still reimburse at this point, since it's the only way we can talk to the person?
Yeah, it's my understanding that Medicaid will, well, let me say this. It's my understanding that Medicaid will reimburse for that, and we can address that next Wednesday to get confirmation on that. But my understanding is that yes, during this, as long as it's not a public facing, you just have to be careful it's not a public facing one.
Okay.
Yeah.
And there was also a link in the slide deck that's a direct link to Health HCA's policies on reimbursement for alternate technologies like that. So
yeah, it's definitely not. It's being recorded. You know, if you open it up, it always says, you know, this video is being recorded, which if you visit people in jail, it's not HIPAA compliant because we can't get private booths anyways. So I always assume that somebody else is listening. So what I'm very careful about is discouraging them from talking about their case that doesn't affect them legally. But this is very definitely not HIPAA compliant, and it's an issue. But there is no way for me to visit this person otherwise, and they need the support.
Yeah, we've been told at the UW by our compliance folks, document. So if you're using something that, this is what we have to use because that's available and this person really needed care and, they were located at such and such a place. And, you can write those details into the visit notes. And
Yeah, that's right. If I understand your question, your point is that when you're in a jail, everything you do is being recorded, right?
Yep.
Everywhere you walk, right? Is that what you mean?
That is what I mean. It's not quite so bad in Kent, but if you're downtown, and I've fought this, if you go up into their lobby, there's a bank of attorney booths, which are private, and there's another bank right next to it for everybody else. And I've tried multiple times to ask for the attorney booth, but I get turned down all the time. And so not only can they listen, but if there's other people visiting their relatives or loved ones in jail, everybody's hearing the conversation. So there is no such thing as HIPAA compliance in jail.
Got it. So this may be a little bit like I need to do a disclosure that I'm not a lawyer, but I would say that there's a fine distinction there between selecting a telehealth platform that isn't HIPAA compliant because it records versus you're in an environment that nature of the environment is recording you. That doesn't mean the platform is non-HIPAA compliant. So for instance, if you had a conversation with that patient, that would be recorded too, right?
Yeah.
So you're just doing something over the platform that replaces what you would have been doing in person.
Yeah, actually, that's true. Yep.
Okay, thank you so much. I want to stay mindful of time and make sure we get to some other questions. Do you want to move to the Q&A, Cara?
Yeah,
There's a couple questions.
I was just going to address those quick ones about the password. You can certainly set up a password if you like, and you just have to make sure that you have that incorporated into your workflow so that the patient gets the password, because it's just one extra step of communication to the patient. Here's the password, and it does make it more secure from Zoom bombing. But I think if you want to use the password, you can do that. You just have to make sure that you're able to communicate that to the patient that they have the password.
Thank you, Cara. I'm going to move over to, we have another hand raised here. Cricket Farr, I'm going to unmute you.
Okay, hi. Thanks for having this. We work with a lot of clients who are in public housing, and those buildings that they often live in are very sturdy, and they are sometimes very challenged in terms of getting good internet access. So even though they may, or reliable internet access, so even though they may have access to the internet, the service is spotty because of their literal walls around them. Any suggestions? I mean, we've tried, going to the windows and things like that, but
I mean, I
That's
don't know if you're talking,
definitely a
Mark, you're
tough one.
muted.
Yeah, if you have spotty, Wi-Fi or something like that, or you don't have a wired connection, that can definitely be an issue. You can use cell phones to connect to Zoom meetings. But yeah, if there's no signal, it's going to be difficult to tackle that issue.
okay.
Yeah, Brad Felker here. I would agree. Sometimes you can work in the community to find a place that has that's willing to support your work. VFWs have been very good about this, and other community setting housing might be willing to set up a clinic room, and they have good Wi-Fi or internet access. You can't create internet access out of nothing,
Right.
and so. The telephone. That's, I often talk about telehealth. Just because you can use it doesn't mean you should use it, and the telephone can still really get a lot of work done. I know that's maybe flying in the face of what we're supposed to be talking about today, but I would opt for a better quality clinical interaction than rather forcing one that could be spotty and leave a provider and a client frustrated.
That sounds exactly like what we're doing right now, and that confirms what we're doing. So
I would really look into your community to see if there be people, obviously we're supposed to be socially isolating and so forth, but I've been impressed by a lot of community support organizations that are willing to set aside a room. They have good work, internet access, and are willing to help be part of the solution during these challenging times.
great ideas. Thanks so
Of course,
much.
that doesn't work for the jail.
Right. Right. Thanks so much.
Okay, do we want to move on to the next question?
Yeah. Do behavioral health agencies need to set up a business associates agreement with Zoom in order to use their application? If you get it through the HCA, no, you don't, because the HCA already has that BAA with Zoom. If you're doing it independently, I would recommend having a BAA with Zoom. And I'm sure that at this point, after all of this, that they have a pretty good templated thing that doesn't take too long to get. Will you be developing any policy and procedure templates for agencies to use in creating policies associated with telehealth? That's a good question. I think that templates would be the good answer to that, is that if it turns out that creating some sort of templates for people, or a checklist or something to think through as they're developing their own policies and procedures and workflows and things like that, I think that's something that we could look into creating. And maybe that's possibly a topic that we might address in one of our sessions and run through that. I think that would be. Good idea.
Brad here again. I might jump in. Yeah, the way we're organizing these, at least these first 4 weeks, is the Wednesday session is going to be on sort of technical and billing and policy stuff. The Friday sessions are going to be sort of more the actual clinical encounter and setting up to succeed in the clinically. And some of the sessions, you know, we have coming up are going to be addressing sort of do's and don'ts and maybe how to set up templates, particularly around safety planning or original consents. And I also saw a question in there about how to work with the SMI population and maybe which are the appropriate patients for telehealth. And we're going to be touching base on those topics going forward.
Thanks, Brad.
Great, thanks, Brad. Hey, Melody, this is Lydia Schwastek again. I just kind of, in the interest of time, this has been a great discussion, and I hate to interrupt, but we've only got 9 minutes left. So wanted to just remind everyone to please do the evaluation kind of as we're finishing up. Just give us your feedback. We're asking questions about kind of who you are, what your role is, and where you're working. And then there's a couple of extra questions that we'll get back to our expert panels. I don't know if you want to say a couple of words, Melody.
Yeah, thanks, Lydia. Appreciate seeing all the questions in the Q&A section. We do have a mechanism for getting back to you on that, and appreciate all of your participation. For further resources, you can go to the Behavioral Health Telehealth Resource website. Our website is listed here, and we're brand new. We're just getting it started. So right now, any questions through this mechanism come directly to me. We're working on fixing that. So thank you very much. Go ahead, Lydia.
Sorry, I think I jumped the gun there, Melody. Sorry. There are a number of opportunities though, so please, we'll take a look at all the questions that didn't get answered today. We'll try to quickly turn those around with kind of a frequently asked questions sheet. But if you are also welcome to access the BHI website, as Melody just said, to type in your questions, and we'll try to get those back to Cara and her team for next week's session related to billing and administrative issues. So as I said, the survey is important to our work. It's really helpful for us to understand how to really tailor this series to your needs. So please take a couple of minutes to fill those out. And then just wanted to say a couple more words about our MHTTC. You can visit us online at our website and follow us on social media. Please email us with any questions, and can go to access all of these resources just to find out about our other upcoming trainings and new online trainings and any resources or research updates, including related to mental health issues around the COVID pandemic. So we'll give people a couple of minutes. Just wanted to thank all of it was a fabulous presentation, Cara, and so much more that we could answer. So we do promise to get to as many of these questions as we can. So appreciate everyone joining us today. And we'll look forward to just a reminder that our next session is, as Brad said, is on Friday. And we'll really focus much more on the clinical aspects of care, and we'll really try to cover all the bases around technical aspects, administrative aspects, and clinical aspects. And Melody, you have a couple of final thoughts, or Cara, you have anything else you want to add before we end?
No, I just want to thank everyone for joining. We've had a much bigger turnout than we had anticipated, and apologize that we can't get to all of the questions. But as they said, we will search through these questions and try to answer them either in upcoming seminars or through an FAQ that we post on the website. So we really appreciate all the participation.
I will say quickly that a couple of people in the Q&A section asked for specific links to some guidance, and I do have pretty quick access to those. I copied and pasted a couple to a few of you. If you would like to follow up with me with email, I can get those to you pretty quickly.
Okay,
Hi, this is Christina Clayton. I am so sorry. Either we have the wrong link to the wrong evaluation posted in the chat, and if that's the case, we will certainly just make sure to email you all directly with the evaluation link for the proper one. So we did create that. We might have just had a typo or something here, so appreciate your patience. We'll get that to you after the session.
Great. Well, we'll look forward to seeing everybody on Friday and then again next Tuesday. And please let us know.
Next Wednesday.
Next Wednesday. Friday, Wednesdays and Fridays. Yeah. And thanks everyone for joining.